I presented a clinical trial of the Roche BET inhibitor, a subcutaneous BET inhibitor, in combination with Venetoclax. BET inhibitors target the epigenome. BET bromodomains are readers of the epigenome, and BET inhibitors change the way the epigenome is read. And there's preclinical information that suggests that BET inhibitors can synergize with Venetoclax to target multiple survival mechanisms in lymphoma. One of the mechanisms is targeting MYC and targets of MYC, and of course, because MYC is active in aggressive lymphomas, this was the population of interest for this clinical trial. We know also that BCL2 is a survival mechanism, and so we hoped that by targeting these two survival mechanisms, this combination would prove to be efficacious. There are other potential mechanisms of actions from the BET inhibitor. Just like other epigenetic agents, they have a really wide biological activity, and there's some immunological changes and potential synergies here as well. This particular BET inhibitor is given subcutaneously. It was given for 14 days out of a 21-day cycle in combination with continuous Venetoclax. And it was a classical dose escalation study. Once a dose was found, we added Rituximab. And so, in fact, we went with a triplet because preclinical data suggested that the triplet would be more active in aggressive lymphomas. We recruited 33 patients with diffuse large B-cell lymphoma. And in the overall patient population, we saw a response rate of 44% and a complete remission rate of 25%. We saw a response rate of around 45% and a complete remission rate of around 24% in a highly refractory patient population. The key side effects were mild injection site reactions. We also saw some gastrointestinal side effects in terms of nausea, loose bowel motions. We also saw asthenia and fatigue as a relatively frequent side effect. At the moment, the company is evaluating the combination and thinking about optimal ways to improve dosing of this combination.